Why cosmetic injectors get into trouble. Most injectors who start aesthetic medicine believe dermal fillers are straightforward. You attend a weekend course, learn injection techniques, and then start treating patients. But after a few years in practice, many injectors realize something unexpected. Complications appear, results are inconsistent, and certain areas of the face, especially the tear trough, become extremely difficult to manage. Problem is not the filler. The problem is training, and today I want to explain why. The gap in aesthetic training. Many aesthetic courses focus on how to inject. They teach injection points, needle or cannula technique, product selection, but aesthetic medicine is much more complex than that. Good outcomes depend on understanding facial anatomy, fat compartments, lymphatic drainage, aging patterns, complication management. Without this deeper knowledge, doctors may technically perform the injection correctly, yet still produce poor outcomes. This is why many injectors struggle with areas like tear trough filler, mid-face volume, jawline contouring. These treatments require anatomical understanding, not just technique. Why complications happen. Over the past decade, imaging studies such as MRI and ultrasound have revealed something interesting. Hyaluronic acid fillers can sometimes persist in the face for years. This means every injection contributes to the long-term structural changes of the face. If the injector does not fully understand deep vs superficial fat compartments, lymphatic flow, tissue integration of filler, then small errors can accumulate. Patients may later develop persistent swelling, filler migration, uneven facial contours. These are not always immediate complications. Sometimes they appear years later. This is why advanced education is so important in aesthetic medicine. The tear trough example. The tear trough is a perfect example. It looks simple, but anatomically, it is one of the most complex areas of the face. Under the eye we have thin skin, delicate lymphatic drainage, multiple fat compartments, important blood vessels. A small volume of filler in the wrong plane can disrupt lymphatic flow. The result may be chronic swelling, puffiness, visible filler. This is why many doctors eventually say, tear trough filler is the hardest procedure to master. And the reason is anatomy. What proper training should include? In my view, good aesthetic training should include 4 key elements. First, cadaver anatomy. Understanding real anatomy is essential for safe injections. Second, clinical practice. Doctors must see real patients and real complications. Third, patient assessment. Not every patient is suitable for filler. Sometimes surgery, skin treatments, or simply doing nothing is the best option. Fourth, complication management. Every injector must know how to manage problems such as vascular occlusion, persistent swelling, filler migration. These skills cannot be learned in a short introductory course. They require structured education. Introducing ASI training. This is exactly why we created the Aesthetics and Skin Institute. Our training focuses on 4 core pillars: cadaver anatomy, clinical practice, patient assessment, and complication management. The goal is not just to teach doctors how to inject, but to help them understand the science behind aesthetic medicine. If you are a doctor or healthcare professional interested in learning more about advanced aesthetic training, you can find more information in the link below. And if you enjoy evidence-based discussions about fillers, skin, and aesthetic medicine, consider subscribing to the channel. I look forward to sharing more with you. Many injectors enter aesthetic medicine through short courses, but dermal fillers require a deep understanding of facial anatomy and complication management. In this video, Dr. Ben Chan explains why many injectors struggle with fillers and how proper training can improve outcomes. If you are interested in advanced aesthetic education, Aesthetics and Skin Institute, ASI, cadaver anatomy, clinical training, complication management. Learn more. Insert course link.